Welcome back to our last day of the Woman in Product Conference. I'm Rani, product manager at Google and member of the hashtag 21WHIP Content Selection Committee. Welcome to the Blaze Your Trail stage. And before we get started, I wanted to take a moment to thank all of our sponsors without whom this event would not be possible. During this session, Hone Your Vision and Find Your Vertical, we'll hear from three honest and humble product leaders. First on stage, we have Shannon Roberts. Shannon is a climate and community-focused B2B product manager. She's passionate about renewable energy, waste reduction, building resilient communities, and left her job in 2020 to take a sabbatical and chase her dream of working to address climate change. She also recently accepted a PM role with Doosan GridTech. I'm excited to hear from her experience and expertise with pursuing a mission-driven product role. Please join me in welcoming Shannon to our stage.
Do you ever feel like you're headed in the wrong direction? That the problems that you're being asked to solve don't seem that important? Maybe you feel like you could make a bigger impact doing something else. Or maybe you're just not in a position where you feel supported anymore at work. Have you ever felt this way? I know I have. And I know how demoralizing it can be and how hard it can be to figure out what to do next. Hi, I'm Shannon Roberts, and next week I start a new job, working in something I'm really passionate about, climate change. And a year ago, I didn't know that this is what I wanted to do, and I was really burned out in my job. So today I'm going to share my personal story about deciding to leave my job, to take a sabbatical. The realities of that sabbatical and how it really felt once it started. The process I went through to heal from burnout, discover my values and vision, and then the steps I took to really research a new industry, get specific in what I wanted to do, and then went all in on a job search. So the first part of my journey is jumping in. I had been at my job for 7 years, started in customer support, led a team, and then moved into product management. But after all these years, I wasn't passionate about the problem that I was solving anymore. I was basically working with really expensive cameras that would make sure that a display was uniform in the right color. And while at the beginning I loved the job, over the years I just didn't feel like it was a fit. But you might wonder, why now? Why after 7 years, how did you finally make this decision? Because the truth was I'd been weighing it for a couple years. I want to share with you 3 things that helped me. The first one was this book called Fit Matters, and I'll be sharing the link to that as well as anything else I mention in the chat. And this book, what I really liked about it is it had some quizzes where you would mark, how fulfilled you felt with mission or alignment or financially. There was also a quiz at the back called Should You Leave Your Job? And I took this quiz and the answer was yes, you should leave your job. So if you're maybe looking for an external resource to just help you figure out if it's a fit or not, I highly recommend this book. I was able to find it at my local library. The second thing that helped me was seeing examples of other people having taken a sabbatical. In fact, my own mom, when she was in her late 20s, quit her job as a mechanical engineer, went skiing for a year, and then went back to dental school. So I'd always seen this as a potential path, and I'd been squirreling away some money on the side for, maybe a down payment on a house in Seattle or maybe a sabbatical. I chose the second one. The third thing I needed to hear, and this came from someone very close to me, was it's not giving up, it's moving on. I was so wrapped up in not wanting to feel like I was, running away from something. I really wanted to run to something, but I just wasn't in the headspace to know what that next something was. So this gave me permission that I wasn't giving up on something. I was just moving on. I also want to take a moment and recognize that a sabbatical is not an option for everyone. There's real financial needs, work visa needs, healthcare needs. I was at a point in my life where I didn't have any dependents and I had a chunk of savings. I didn't need a work visa and I was eligible for Medicaid in Washington state. I also had family that I knew that I could fall back on, so it didn't seem like that big of a risk. I also want to say that I think that there's ways to do this without taking a sabbatical, and I don't plan in the future every time I'm unhappy with my job to quit without a job lined up. I honestly hope I never have to do this again. But if you have the means and you think that you might be burned out, a sabbatical is a good option, and it's not giving up, it's moving on. So let's just say that my sabbatical did not look exactly like planned. Started in March 2020, and while I had kind of an idea of what I wanted to do, I did not expect to have so many regrets about it. I thought things like, whoa, if I just didn't have to have my commute of 2 hours anymore, maybe that's all I needed. Or, oh, well, now I get a break from traveling. And I wondered if I made a horrible mistake. I was also seeing a lot of people that had, involuntarily left their jobs. Product managers at companies I really admired were laying people off. And here I was, deciding to leave my job on my own. So I will say that quitting your job isn't a way to just immediately feel better. I also really resisted taking a break. I remember that first week I decided I needed to learn SQL and sat at a desk and tried to do that, and it just isn't what I needed. I was so glad that I had a friend that told me, Shannon, you need to take a break. You need to just stop working. And it's so hard when for so long your worth is tied up in your work. Now that you're suddenly not working, like, what are you even good at anymore? So I gave myself until July to not look at jobs. The global pandemic was kind of a convenient excuse. I went from thinking, oh, I just need a month, to now, okay, you can take maybe 3 months because no one's hiring right now. And looking back, I think even without the pandemic, I would have needed more time. So if you are considering a sabbatical, just be realistic. A month off might not be all that you need. So now I entered the next phase that I call well-being. During this phase, I found a really awesome free course on Coursera called The Science of Well-Being by Dr. Laurie Santos. What's great about this course is first she goes through the misconceptions about what we think makes us happy versus what actually makes us happy. It turns out it's not the money above a certain threshold. It's not the prestigious job. Instead, she offers 6 rewirements, and these are activities that she guides you through to work on your well-being. And today I'm going to share 3 of them with you. The first was meditation. You've probably heard about meditation before. I know I had, but through this was the first time that I actually developed a habit. Additionally, at that time, I was meditating with a group of women through the Women in Product, led by Devin Pipers. I'll drop a link if you want to join us. And that helped me both with meditation and community. The next one was savoring. And this is something I'd never heard of before. And it's open to interpretation. I chose to savor long walks. So I would be outside and I would notice the leaves on the trees or the smell of the air, the rustle of the waves on the lake near me. And this just helped me honestly be happy again. I started to want to do art and draw the flowers that I saw and just, I actually started to heal from burnout. I didn't realize how much I was holding in my body and just how bad that I felt. The third one was using your signature strengths. She has you take this quiz, recognize your strengths, and then do an activity that uses them. In my case, leadership was one of my strengths, and at the time, the nonprofit that I'd been volunteering with for 8 years, it's called the Northeast Seattle Tool Library, TOOL, suddenly needed my help. During my sabbatical, I figured, maybe I'll do an annual report for them, but it turns out that, we had to go from meeting once a month to meeting once a week. I led changes in our tool reservation system and started volunteering in person, something that I hadn't done in years. And this just made me feel better and realize that I have a lot of skills. So if you're curious about this at all, I highly recommend this free course. And so now it was about July, and yes, I felt better, but I didn't have a direction. And when I sat down to look at my resume, I kind of fell apart. I couldn't look at it. I didn't feel like I was good at anything. And I was like wondering, am I even qualified to be a product manager? I was super intimidated by the interview process. I had transferred internally from customer support and had thoughts like, oh, I'm only a PM because I know our product so well. So I decided to hire a coach. And this is when I enter the phase called vision and values. My coach, Becca Camp, I found through Women in Product and really connected with her approach of addressing physical dysregulation, as well as a guided path to work on my values and my vision. And I can't share with you everything that we did. I would need a whole other hour, but I'll give you just a flavor of some of the things I worked on. One of the things was a values exercise. I had never really gone through and identified them before. We worked off a list of values created by Brené Brown, and I identified 10 values that stuck to me. 4 of them that I'll share with you are adaptability, resilience, safety, and the environment. And I was a little bit surprised at these, actually. Especially like safety and the environment, I was like, oh yeah, those are my values. The next one was vision. And this was imagine a world where, and I had things like, I can use my talents and abilities to show up. And I started to refine it a little more and had this kind of inkling in the back of my mind of wanting to work on climate change. And so far in the story, this might sound like it's coming out of nowhere, but in fact, it's always been buried deep inside of me. When I graduated from college in 2012 with a degree in physics, basically all that I knew was that I didn't want to go to physics grad school. I then got it in my head that I wanted to work in sustainability. I wish I could tell you exactly what sparked this. I can't remember. I think that it goes back to maybe watching An Inconvenient Truth in middle school and really feeling motivated by that. But all I know is after college, I decided I wanted to work in sustainability. I did things that I'll recommend to you today, like going to conferences and networking with other people. But at the time, I wasn't able to get a job. It felt like the industry wasn't growing, and I saw a lot of new grads with degrees in environmental engineering that were also lost. Luckily, this is when I found the Tool Library. It's a project of Sustainable Northeast Seattle with the goal of reducing waste by providing tools. And this let me feel like, okay, I'm working in sustainability. I'm doing this on the side. It's okay if I get a job in something else. And so I did. I got a job that wanted a physics major, and then 7 years later, I was like, wait, I don't want to do this anymore. So going through this process, it helped me figure out what I wanted to do. And the truth is, I did know deep down. I just had these misconceptions about what it was possible for me to do. So if you're sitting here and okay, I want to work in something mission-driven, but I don't know what I want, I encourage you to think back of, is there something you've been interested in before? Is there, when someone tells you what they do, is there a certain type of job that you just feel this spark or a little like, I don't want to call it jealousy, but kind of, being like, oh, I wish I could do that. And then be willing to say, yes, I want to do this. So now I entered phase 4, and this was exploring the industry because let's be real, I don't want to pick an industry that isn't growing or that's not going to set me up for the right direction. I've already done this big shift once. I really don't want to have to do it again. And this is also where I started to have some fun. I was really curious about the solutions to climate change and how the industry had changed in 8 years. And the good news is it had. There was a real upswing of investment after that real clean tech 1.0 bubble burst that happened right in 2012 when I was looking previously. So I also think that if you say you want to go into something like climate change, you have to get more specific. And I'll share a few resources with how you can do that. And the way that I like to think about this is, if you're a product manager and you're going to take a new product to market, you don't say, oh yeah, this product is perfect for everyone. No, you get specific and explain exactly who it's for and why. And yes, maybe you're narrowing your target, but that's how you can actually enter. The first thing that I did was I found this book called Project Drawdown. And drawdown is the point where we stop adding more carbon and it starts getting removed. It's a very hopeful book. It thesis is basically we have all of the tools and the technology that we need to address climate change. We just need to put them into action. And I read through this, didn't get through all of it. It's a very long book. Good news is they have a free Climate Solutions 101 course that just came out. So if you prefer a course, that is available. And when reading it, I picked my top 3 interests. The first one was the electric grid. I liked this because it touched all of the solutions and it was kind of a way to not have to pick everything or pick one thing. You know, if you want electric vehicles, you need a grid. If you want more wind and solar, you need a grid. I also felt that with my physics background, I would have a tie in there. The next one was solar. I've always been interested in solar energy. I even tried to, put solar panels on my parents' house back in 2012, but I didn't follow through. I also found a connection between my experience in lighting design and measurement and solar array design because, what is the sun but just a giant point source in the sky? And lastly, I chose the circular economy because that was tied to my work with the tool library and I felt like I had some real, experience there. So aimed with these 3 things, the next step is to just tell everyone. Any chance that I got, I would tell people I was interested in it. And I continued to do some primary and secondary research. So the secondary research, like reading Project Drawdown, newsletters, I'll share a couple, such as Climate Tech VC, podcasts like The Energy Gang or The Intercept, and just immersing myself in it. My plan was to do, make it easy. Like, where was I already going to get this information? Like, if you don't read newsletters, don't go sign up for a whole bunch of newsletters. If you don't listen to podcasts, don't go look at podcasts. There's Instagram accounts and there's ways that you can look where you're already getting your information. This also helped me to kind of become a little bit of an expert in the field. I realized I had opinions and thoughts and could really carry a conversation. Part of what I did too was going to a conference by Solar Washington. And one thing I want to say about conferences is it can be really hard when you're unemployed. Sometimes they cost money. I recommend reaching out to see if you can get a discount ticket. A lot of them offer it. But also just the registration process on its own, having to fill in where you work, what your job title is. And when you don't have those, it can just be really hard. So if you're going through that, I see you, and I think it's so brave. Now I was ready to go all in. I started researching companies in Seattle and really started networking. And this was something I resisted. I don't want to talk to people. I feel like I'm bugging them, but I followed the 3-link rule from my coach, Becca. She has a great blog on it that I'll link below. And it basically says that the third person that you talk to is the one that can get you the job. So you just want to start talking with people. Start with your friends, someone in book club, kind of a weak tie that you have, and just talk with them and focus on what are you curious about, right? You don't know everything about your friends. There has to be something you're curious about. Explain what you want to do and your interests, and then at the end, ask them, who else should I talk to? And, about half the time they had someone to talk to next, or they suggested it, and then you do the same thing with them and the third person in the link. So I followed this strategy, and it is ultimately how I got the job that I'm starting next week. I was on a networking call with someone for a completely different job. She was someone who had cold connected with me on LinkedIn a couple years earlier, and then I reached out. While interviewing, I was also pleasantly surprised that that people would talk to me. And I actually found that the reasons I got rejected from jobs had less to do with my industry experience and more to do with the type of PM. So I'd encourage you, if you're making this leap, I was B2B working on big projects, so I targeted staying in B2B working on big projects. I also connected with other women in product through the Facebook page. So I actually met another woman who was in a similar position. She wanted to make an impact in climate, but wasn't in a position where she could leave her job. And we had a call, we shared our interests, ideas, and offered support. And then I checked in with her a couple months later, and it turns out that she's now working on a big project internally where she's going to make a huge impact at scale. by doing a sustainability job internally. And so I asked her what advice she would give. And what she told me is take the initiative to talk to people and make your intention known. Do your homework by building expertise in the field outside of work, and volunteer outside of work. Sustainability is not something you wait for. So this is advice that I completely agree with, and I think it also shows that you can make this transition without leaving your job. I think especially in the next decade, as more of these big tech companies start to address sustainability in their manufacturing or data centers, there's going to be so much opportunity, and now's a great time to get it. So today I've shared with you my journey from finding space by jumping in, showing up and working on my well-being, working with a coach to find my values, and how I validated the market. I also want to say that you don't have to be done to tell your story. When I applied to speak at this conference, I didn't have a job offer. When I learned that I was accepted to speak, I didn't have a job offer. In fact, I'd just been rejected from a really cool solar startup. And as I'm talking to you today, I have accepted a job offer, but I haven't started my new job. I'm nervous. Can I still work on my well-being while I continue to meditate? And I don't know the answer to that, but I want to share with my story with you where I am today, and I hope that one day I'll hear yours. Thank you.
Thank you, Shannon. And we can all take a moment to recharge and refocus our energy from this talk. Next up, we have an in-conversation emerging tech, digital health and beyond with Richa, Gujarati, and Anu Ramakrishnan. A biomedical engineer turned product marketer turned product manager, Richa is passionate about building products at the intersection of technology and health, and to leverage technology to empower and delight users and drive meaningful change in their health. She is the product management and go-to-market lead at Apple currently. Anu Ramakrishnan is a director of product at an early-stage digital health startup in the neuroscience space. She's passionate about developing technology solutions to solve some of the hardest problems in healthcare and improve patient lives. Anu has previously led health tech products at Genentech and at Samsung Health, and is an advocate for improving outcomes and lowering costs through digital healthcare. Without further ado, please welcome Richa and Anu.
Hi, everyone. It's great to be here today. My name is Richa Gujarati, as you already heard, and I currently work for one of the big tech companies, Apple, with the focus on health. My area of focus in particular is a lot of roadmap and product development activities related to regulated health features, so the likes of the ECG app on Apple Watch. I'm also heavily involved in a lot of public health research studies. And the sole objective and a lot of these activities that I do and the products that I work on is that mission to empower consumers with data about their own health and democratize health research studies. Anu, what about you?
Awesome. Thanks, Richa, for the intro. And as Richa said, great to be here and meet all of you, and hope you all are safe and sound wherever you are. So as mentioned, my name is Anu Ramakrishnan, and I currently work as a principal product manager at Genentech, which is part of Roche, which is a big pharma company. And within Genentech, my role is leading product management for a digital health technologies team, where we're focused on the development of clinically validated and regulatory-grade digital monitoring and digital therapeutic products in oncology, ophthalmology, and urology. And prior to Genentech, I've been in product manager positions at a couple of different companies. So my last role was at Samsung Health, where I worked on essentially building and scaling a remote monitoring digital health product for cardiac rehab, which had significant milestones in terms of improving patient outcomes and reduced costs. And prior to that, I worked in the medical device industry, which then sort of evolved into digital health. In various roles from systems engineering all the way to product management and product analysis. So Richa, I'd love to hear from you kind of how you ended up in digital health, and I'd love to hear your story.
Yeah, so interestingly enough, when I started my career in health tech, digital health was really not the craze it is today. And to be honest, it was this vague term that wasn't really well understood. And, sort of looking at it today, even today, digital health is this amalgamation of everything, ranging from mobile health and personalized medicine to health IT to wearables to telehealth. I mean, you just heard the different kind of things that you and I work on. So come to think of it, even though I didn't think I was working in digital health, I was certainly working in it because from my very early days, even working in medical devices, the objective has been to leverage technology, even in its crudest form, to have an impact on patients and their lives. And while the technology has certainly evolved, we've come a long way from that perspective and gotten more sophisticated with the likes of wearables, some amazing sensors on your phone and your watch and smartwatches. The objective still remains the same, right? It's to leverage technology to have an impact on people's lives and to improve overall health outcome.
Yeah, absolutely. I think my story is also very similar. I think, as you said, like digital health didn't really exist as a thing, or I guess it wasn't as popular as it is today when I started my career. But I think quickly it sort of evolved with the rise of, consumer tech and wearables. And as you mentioned, like, the plethora of sensors that are very easily available to consumers, and really trying to figure out like how can we expand its use across not just general consumers, but also, chronic patients and disease populations. And so I think, as much as that was not really the aim from the beginning, I think, it just kind of naturally sort of evolved into what it is today. So yeah, I mean, I'd also love to know, kind of your story. Like, how did you kind of pivot into digital health? Like, was this or was healthcare even kind of your remit from the beginning?
Yeah. I mean, I think it's really funny that both of us were working in digital health, even though we thought we were just working in medical devices. I think one of the coolest thing about working in the healthcare space, and to sort of more specifically digital health, is the passion I have for leveraging technology for the greater good. And for me personally, that sort of begins and ends with consumers. So how do we leverage technology to make health information more readily accessible? So you don't have to rely upon going to your doctor's office and calling your doctor's office and request electronic health records sent to you via paper trail or email. How do we really empower users and consumers more specifically with insights about their health so they can have that dialogue with their doctors? Get diagnosed and treated accordingly, so they can, take real world data and share it with their doctors. And ultimately, for me personally, the biggest passion of mine is how do we leverage technology to advance science, particularly in areas that have somewhat stagnated, because the level and scale of participation that's required simply can't occur. Because if you need to go to a clinic or need to be seen by a doctor every month to get your health data collected, that's just not feasible. That really prevents everyone and anyone from participating in these research studies. So how do we really make it easy for the general consumer to participate in research studies, no matter where they are, so we can really advance our thinking about health conditions, about various disease areas that requires that level of scale and level of participation to really move the science forward.
Yeah, absolutely. I think you touched upon something very critical about patient access, right? And I think that's something we saw pretty obviously during the COVID-19 pandemic with how the sort of rise of telehealth and the sort of spur of adoption in telehealth, because that almost was a necessity to continue providing access to care for a large portion of patients. So yeah, I think that's that's pretty spot on.
Yeah, but would love to learn from your perspective too, given you've sort of specialized in this very niche area with the likes of pharma and biotech companies trying to make their foray into digital health. What really has sort of motivated you in that space, kept you going, and what do you look forward to the most?
Yeah, great question. And for me, I think it started out a lot more simpler. Like I think back in high school wanted to be a doctor, but I just realized the path to getting to becoming a doctor was just too long. And so I was like, what's the next best option? And so, bioengineering was just, the perfect choice for me because it, really merged the science and the technology and the engineering all together. And really, I was just looking to figure out, what's the best I can do with a bioengineering degree. And so, healthcare and medical devices really was kind of where, the job was at back in the day. And for me, I think, having a direct impact on patients' lives and sort of, the points that you mentioned, which is, I think with technology, of course, I think all technology, consumer technology specifically, is trying to shape people's lives, but having an extremely direct impact on someone's health, which is, their biggest asset, is, pretty profound. In my career so far, as a product manager, I've had the unique opportunity to interact with several patients and talk through sort of how our products have helped them in their health journey. And, it's really amazing to hear stories about how, an app we created or a program that we help patients get into really helped create behavior changes that helped, change some of these lifelong poor habits that have led to poor health outcomes. And it's really great hearing patients say, hey, your product saves me from a second heart attack. And, it's really personal stories like this that keep me motivated to keep going in this space. And I think another thing is I really enjoy the different challenges that come with developing digital health products, right from, working across a very diverse pool of stakeholders. You have your clinical stakeholders and your regulatory and legal folks, and then also your traditional sort of product teams, like you have your design team and engineering team who are working on the technical delivery and execution. It's really, as a product manager, particularly trying to balance all these expectations and making sure that you are doing what's right for your patients, but also making sure you're, thinking creatively about how you can bring these products faster to market. I think all of these aspects have been very, very interesting and, has kept me going in this space. So, on that note, I was kind of wondering, what do you think are some of the, key skills that one might need to have as a product person or product manager to succeed in health tech?
Yeah, I mean, a lot of what you said sort of translates into the skill sets that you really need to have to be successful in digital health as a product manager. I'll sort of underscore the value of being able to think about it from a user perspective. One of the unique tensions that we face in healthcare and digital health in particular is who are you actually building the product for, right? So a lot of times you're ultimately building the product for an end user or end consumer, but then the one advocating or prescribing the product may be a healthcare provider or a payer. So how do we ensure that you're also thinking about things from that perspective and making sure you're driving the right level of advocacy with that physician group, with that payer group, even though you're not ultimately building the product for them. But then at the same time, making sure that the product that you're building is super intuitive, easy to understand, and just can be adopted at a wide scale to have that level of impact. That's key. And that honestly really begins with having the biggest level of empathy you can, right? One of the unique things about working in digital health, unlike just regular consumer tech, is your target demographic or target user may not have the same needs as what an average consumer may have. Your average consumers is anyone, including yourself. But depending upon the product, the industry, the disease area that you're trying to target, the needs of that consumer and that user that product is trying to target could be very, very unique. So how do you really think about things from their perspective? How do you put yourself in their shoes? The ability to ask all the right questions and really double downing on this concept of user journey and going deep into it. This ability is something that I do believe very strongly is unique to healthcare and digital health in particular, and can really set you up for success as a product manager in that space. And lastly, this kind of comes after the fact a little bit, but I do want to sort of emphasize how important it is to have a basic understanding of the various business models that exist in the healthcare space. I see a lot of digital health companies where the business model is either iffy or not fully well defined. And so if you want to be successful as a product manager, on the one hand is really understanding your user base and, putting yourself in their shoes and really understanding the problems they are trying to solve with that, your particular product. But then how do you monetize on this product? The digital health space is unique in the sense that very often consumers aren't the ones who will pay for the product. It may be an insurance company, a payer, or a healthcare institution, or a self-insured employer if you go the B2B2C route. So having a basic understanding of these various business models, and then depending on the product you end up building, just being able to double down on these various ways of monetization is really the key. And then the last thing I will say is, I work with a lot of tech PMs in my day-to-day, and I think what makes a PM in a tech company successful also translates well to digital health. But then there are these nuances that you have to account for, either to your point, understanding the regulatory landscape and being an expert in it, understanding reimbursement, how do you get paid for something and being an expert in that, or hyper-specializing in a particular disease area or a health condition and really understanding the needs of the users. I think having that journalist background in conjunction with these specialties can really set you up for success in the digital health realm.
Yeah, absolutely. And I think you really highlighted all the, key points. And I think, I think that's something to really stress on where, I've been in both, tech companies and also sort of the science, medical device, pharma companies where I think each bring their own strengths. For example, when I was working at Samsung, there were definitely a lot of aspects of human-centered design thinking and best practices with mobile and wearable design and everything that we could really leverage because that was, fundamental to the company's success. But, there were definitely parts about, the monetization strategies or sort of the cybersecurity and privacy aspects, which, play a very big role when it comes to hosting and managing health data. Like a lot of those pieces kind of need to be re-emphasized because it's sort of less prioritized when you're developing more B2C focused applications. So I think as a product manager, understanding where to make those trade-offs and how to essentially balance those kind of key decisions when you develop your product roadmap and your sort of strategy, having that sort of maturity to understand that I think is really fundamental. And I think the part about reimbursement is also very, very important, right? I think that's something that honestly, even I'm trying to come up to speed with because there's so much that's changing every day with at the policy level and at the, at the business model level where, I think a lot of these monetization strategies are fairly new, especially when you think about traditional wearable products or hardware products where typically they rely on reimbursement codes and RPM solutions, for example, rely pretty heavily on reimbursement codes to get to get paid. A lot of these codes are also evolving as we speak. I mean, COVID, I think, was pretty fundamental in sort of digitizing several codes for telehealth and virtual patient care. And so I think the sort of regulatory landscape is also evolving as we speak. So keeping up with all of those changes and making sure that you're in the know-how of what can be leveraged really to help monetize your product and ultimately, bring value back to the business as well, I think is key. Cool.
Yeah,
so, sorry, yeah, go ahead. Go ahead.
No, I was just saying, I fully agree with a lot of the sentiments that you shared. I think ultimately with what makes a company really successful in digital health in general, or what makes a product manager really successful in digital health in general is taking and seeking inspiration from these various areas, right? Building products that are intuitive, easy to understand, easy to use, with that element of human-centered design, but then having a basic understanding and respect of the regulatory frameworks. How do you play in the regulatory landscape? And then lastly, having a good understanding of what it takes to get paid for a healthcare product, right? And these are all the things that are super important to sort of highlight and for a PM in digital health to be aware of.
Yeah, absolutely. So I was wondering, maybe, as kind of closing comments, what do you think, what would your advice be to product managers who are sort of in more sort of emerging markets or emerging tech fields, and what would be your advice in terms of how they can essentially build a niche for themselves as a product person and sort of stand out in digital health, or whether it's any kind of emerging tech field?
Yeah, I mean, it kind of goes back to the fundamentals of a PM, like what it takes to be a successful PM. As I was mentioning earlier, I see a lot of my tech PM colleagues doing a phenomenal job at working and building healthcare products. A lot of the skill sets, right? Really, the ability to work cross-functionally, to ability to influence without a lot of direct authority, the ability to really voice out a user's perspective and having that sense of empathy so you can think about it from a user's perspective. All of those translate really well. And then at the end of it comes a good understanding of the overall healthcare landscape. So whether it's understanding if your product will need approval from the likes of FDA, even if it's a software or a digital product, what is the process required there, and how do you go about pursuing something like that? Again, understanding whether or not the solution that you're pursuing has a viable business model. How will it ultimately get paid? You can't always rely on consumers to pay for health technology. It's just the evidence isn't out there that consumers are that willing to pay for health technology. So then who will pay for it? Can an insurance company reimburse for it? Why? What evidence do you need to generate? And I mean, these are all the things that I think someone who is somewhat of a journalist needs to understand, needs to learn, needs to develop an expertise in as they look into transitioning successfully into digital health. So for me personally, I come from a medical device background too. I've worked on products like pacemakers and spinal cord stimulation and deep brain stimulation device. But my journey, whether it's working for a technology company, working in healthcare, or whether it's working for other digital health or med tech companies, where I have chosen to sort of specialize is really understanding that regulatory landscape and what it takes to get paid for a digital health product. And that's really what's allowed me to be successful in this industry. And I think, anyone in a tech world can do so, can transition successfully, but they'll need to have a good understanding and at least somewhat of an awareness and grasp of some of these fundamentals.
Yeah, no, that's a great. That's really great. I think for me, I think I'll share a little bit of a personal story, which is, I think as a product manager, you kind of often have a little bit of a FOMO as well, where, I think traditionally in the market, like product management is often associated with, consumer tech companies and like, social companies and things like that. And it's less known that product management exists as a function in a lot of healthcare companies in general. And I think it's also something that's up and coming. Like, for example, I think I'm probably one of the first few like digital product managers who've been hired at a big pharma company like Roche, because, I think they're now starting to understand the importance of having digital product management in healthcare and, the value that product managers can bring. So I think for me, there's definitely a lot of conflict in my career where I was like, well, should I just, pivot out of healthcare and do something more consumer tech oriented and really kind of build that pedigree? But I've definitely held back because I think there's an aspect of, introspecting a little bit and thinking about what are some of the unique skill sets that you bring in and what's really your story, what keeps you motivated. And, I think we talked at length about a lot of things that, keep us motivated to be in this space. And so I think for me, it's been a lot of thinking strongly and thinking back to those roots about healthcare and why do I care about patient outcomes and why do I care about making an impact, which is kind of motivated me to keep going in healthcare. And even though it is an emerging space and there's a lot of, as you mentioned, like there are so many moving parts around, business model and regulatory strategy. And a lot of these things might look a certain way today, but might look very different tomorrow. I think the constant opportunity it provides to keep learning and growing, I think has been sort of what motivated me. And so that's my advice to other PMs. Like if there is a specific technology, function or an area that you're very passionate about, maybe because you were already a technical person there, you were an engineer who started out in ML or AI for an example, and you're really passionate about that space, I would say like find your story and find your path and kind of stick to that and see how you can really position your experiences to sort of shine in that space, as opposed to trying to be a jack of all trades and doing something just because everyone else is doing that. So yeah, I think that's what I'd like to say in closing.
Well, wonderful. That was really great to hear your experience and sort of a very contrast view to how we think about healthcare and product management and healthcare on our side of things. So, I think the takeaway for the audience should really be there is no one size fits all approach. You said it really well. Find your specialty and then find your area of passion. And then just figure out like what can make this product successful. Is it you really understanding your user, or is it something else? And just run with it.
Yeah, absolutely. And I think there are so many things about product management that are generalizable across the board. But I think within healthcare, there's just so many unique opportunities to learn and grow and approach products in a sort of different mindset. And so, yeah, absolutely. I hope you all kind of took away something from this discussion. And of course, we'd love to connect with you all offline in the interactive sessions as well. So please feel free to bring your questions there, and we'd love to interact with you all. Thank you.
Thank you, everyone.
Thank you, Shannon, Richa, Anu, and to all of you who have joined us today for this session. I personally have learned so much from these sessions, and I hope all of you decide to connect with our speakers in our follow-up interactive sessions later today. Check the agenda for more details on this. And one last reminder before we wrap up here, you can also download our app for the complete agenda details and access to the stage recordings. Stage replays are available in the app at the end of each day, along with worksheets, slides, and resources. Thank you again for joining us, and be sure to come back for our next session on this stage, Identifying Potential and Welcoming Change.